Hello again, I'm Joel Barthelemy. Good health depends on a combination of factors, and they're most effective when done in combination. Just simply walking for 30 minutes several times a week is good for the cardiovascular system. Often it isn't what we eat, but how much and how fast. Usually, the faster we eat, the more we eat, so moderation is an important aspect. And we've all burned the candle at both ends at some time in our lives, but most of us now appreciate quality sleep and suffer the next day when we don't get it. Scientific studies have shown that all of this plays a role on how healthy we are. If we exercise, watch our weight, and have a consistent bedtime, we choose to act more responsibly in terms of our health. On the other hand, the people who choose unhealthy behaviors are likely to be sick more often, miss more days of work, and when they are at work, tend to be less productive. They're not operating on all cylinders. There is a term for this, and that term is presenteeism. It's a kind of functional impairment that may be due to a chronic disease like diabetes or hypertension. A lot of people with problems that result from their lifestyle find it difficult to change, whether it has to do with smoking, drinking, or staying up late at night. As a proactive measure to counter this attitude, employers are developing wellness programs, and usually they provide incentives to employees to encourage them to live a more healthy lifestyle. There are two approaches to this, the carrot and the stick. Most employers prefer using the carrot approach to nudge their workers into participating. Things like setting up a Weight Watcher meeting at the office, providing YMCA memberships, and rewarding those who achieve personal goals. If the carrot approach doesn't work, they may consider the stick, penalizing those who cannot or will not voluntarily get involved. The penalty could be an increase in what employees pay towards the company's healthcare plan. Insurance companies are mulling over similar issues involving choice. When someone doesn't follow sound medical advice that would help prevent and treat disease, should insurance carriers deny the benefits that others would enjoy? For example, some would argue that it's only fair that people who use tobacco should pay more for health insurance because they're more likely to develop chronic diseases like emphysema, COPD, and even cancer. I've never really used tobacco, so I don't know the difficult times in quitting. But some believe that people who are addicted to nicotine should be helped, not penalized for something they haven't been able to stop doing so on their own. But then what about those with highly active and somewhat risky lifestyles? Weekend mountain bikers, marathon runners, and softball players. Basically anyone who plays sports. I played rugby in college and watched as my teammates dislocated their shoulders and broke bones. I quit after 3 years because truly I couldn't afford the insurance and the odds that I would be injured were piling up. Should health insurance cover athletic injuries and recuperation? How do we handle things like this? How should we handle them? I'd like to hear your ideas. Send me an email, won't you? Send it to Joel's blog, that's JOELSBLOG @globalmed.com. I'm Joel Barthelemy.